What is an adenoma in colorectal cancer detection? Imagine a tiny growth inside your colon or rectum that might seem harmless but could be a warning sign of something more serious. That's what an adenoma is. It is a benign, or non-cancerous, growth that develops from glandular tissue lining the inside of your large intestine. These growths are often called polyps because they protrude into the space inside the colon or rectum. Adenomas are very important in the world of colon health because they are considered precursor lesions. This means they have the potential to turn into colorectal cancer if they are not found and removed early. Detecting adenomas is a key part of colorectal cancer prevention because most colon cancers develop from these benign polyps over time. During a colonoscopy, a doctor uses a flexible tube with a camera to look inside your colon and rectum. This procedure allows them to spot and remove adenomas before they can develop into cancer. There are different types of adenomas, classified based on how they look under a microscope. The most common are tubular adenomas, which have tube-shaped glands and usually carry a low risk of becoming cancerous. However, if they grow larger or have certain features, like a villous structure or high-grade dysplasia, their risk increases. Villous adenomas are made mostly of finger-like projections and have the highest chance of turning into cancer, especially if they are larger than 10 millimeters. Tubulovillous adenomas are a mix of both tubular and villous features and carry an intermediate risk. Sessile serrated adenomas are another type that can look different under the microscope but are also considered precancerous. When doctors find an adenoma, they assess whether it is advanced. An advanced adenoma is usually bigger than 10 millimeters, has a villous component, or shows high-grade dysplasia, which means the cells look abnormal and could become cancerous. Removing these advanced adenomas is crucial because it can greatly lower the chance of developing colorectal cancer later on. Having adenomas, especially advanced ones, means you might need more frequent colonoscopies in the future to keep an eye on your colon health. This ongoing surveillance helps catch any new growths early and prevents cancer from developing. In summary, an adenoma is a benign growth in the colon or rectum that can serve as an early warning sign. Detecting and removing these growths through screening colonoscopies is a vital step in preventing colorectal cancer and maintaining good colon health. If you have concerns or a family history of colon issues, it's always best to talk with a healthcare professional about screening options and personalized risk factors.